We have a special program lined up today, and that is what to do if you're ever involved in an auto accident. I'm Mark Payton. I'm joined by Doc Tony and Blue. So this is going to be a great show and a lot of information that people need to take notes. Let's start out with force, and that's what happens when you're in an auto accident.
Right, so you think about, if you ever watch somebody playing football, right? And the receiver goes across the middle of the field and he gets tackled, and you see the guy when he gets tackled, you see that head snap back and forth. That's whiplash. So when somebody's involved in a car accident, let's say a very common car accident, because the way you get hit determines which way your spine's going to go. Example, if you get hit from the side, your spine's going to go, laterally. If you get hit from the back, it's going to go forwards and then backwards, okay? So what happens is, let's say a car's traveling 30, 40 miles an hour, guy's coming up to a light, doesn't see that everyone's stopped in front of him, boom, and they rear end you. What your head's going to do, it's going to suddenly accelerate back first. That's why they have a headrest in the car. Your head violently goes backwards and then it snaps forward. So that force that hits that car goes through that car and it goes through the body. Now, these bones in your spine, this being the back of your head, you're sitting here in your car and all of a sudden you get smacked, your head violently snaps, it overstretches and it tears the soft tissue that holds the spine together. And people don't necessarily feel that right away. You can just start out as a little soreness, but what people need to understand is the soft tissue is what supports the joint. So if you mechanically alter how this spine is going to function, a good example is a car. If today I'm driving in my car, boom, and I hit a big pothole and I know I knocked the alignment off, I don't necessarily see how bad that's going to be that second, but a month from now, if I were to leave it like that, the car would almost make a U-turn by itself because the tires have worn out so much.
And let's talk about, there's different types of accidents. Obviously, there's really bad ones where people have to go to the hospital right away.
Right.
But then there's others that are fender benders.
Right.
Both parties get out, they walk around the car. It doesn't seem like there's anything wrong.
Right.
But internally, and when you talk about soft tissue, there's a good chance something's brewing.
Right, absolutely, because the soft tissue is not meant to absorb that type of impact. Anytime your joint just violently snaps, and you're not expecting it, especially. Most people are sitting there relaxed when they get hit. That's why your head just snaps so violently. That's why they have headrests in cars. Back in the olden days, they didn't have that headrest. So when you got hit, your head kept accelerating back and it would actually paralyze people. So now what happens when it gets even a light little boom? Like I said, when I'm talking about the football player, that's a 220-pound man that's hitting another, 210-pound man. So you can only imagine a 3,000, 4,000-pound automobile doing 30 miles an hour, hitting a car, boom. And most people, what do they care about once they've had an accident?
It's sad, but their car.
Right.
They walk around their car.
Right, and wherever they were going,
Sure.
you're a little, oh no, wherever I was going, I'm not getting there no more, I'm late for work, so the adrenaline's going, you're thinking about that, and you're not necessarily just sitting here thinking about, and it all hasn't set in right away anyway. Anytime you played a sport, and you sprained an ankle, let's say it's in the middle of a football, you're playing football, and you know you rolled your ankle, you can keep playing that game.
Sure.
But later on that night, you can't walk. So it takes a little while for all the inflammation to set in, for all things to take its inflammatory response after you sustain an injury before you actually know you've had an injury. And sometimes you don't feel that even right away. It could be just something shifted just a little bit. Maybe people who have stepped out of a car wrong or stepped down a stair wrong, and you feel something, ooh, something went, but I'm still okay. And then you keep going with that for a couple of weeks, it becomes a more severe problem.
And let's talk about that, because you're talking about soft tissue injuries, and these are the type that kind of mask themselves at first, and then really throughout time they get worse. So what exactly is a soft tissue injury?
So soft tissue is when we're talking about muscle specifically, because you have other types of soft tissue as well, but things that are more commonly injured in a car accident, whether it's going to be a knee, whether it's going to be a wrist or a shoulder or your back, because all these things are potential areas to have injuries, because when somebody's in a car and they're holding onto a steering wheel, and let's say you're the person doing the hitting, could you imagine walking into a wall, just walking and sticking your hands out, boom? I mean, it would create quite a little jolt, right? And your knees and your wrists, and as well as your back. So your soft tissue is going to be your muscles, which enable you to move. Like you injured your hamstring.
Yes.
Okay, your hamstrings will enable you to run, so that flexes your knee. And now that you've injured that, you have scar tissue in your muscle.
And it lingers. It takes forever to rebuild itself.
And sometimes it's always there. It may never go away.
Don't say that.
I mean, you have to do your, and look at
Sure.
you, and you're a guy who's in great shape, you take care of yourself, you're diligent on doing this. A lot of individuals, they're not in the gym, they're not working out, and they're not in always, the best physical shape when they've been involved in a car accident. So now it can involve not just muscles, but it can involve the ligaments and the tendons. And the ligaments is where it becomes really dangerous. Like a football player, he can injure one, let's say he tears his ACL. Well, that's one ligament in his knee, but his career could potentially be over because the ligaments are what holds those bones together. It's like we talked about this before. If I put shoes on and I put my shoelaces on tight, then my shoes don't go flying all over the place. But if I put my shoelaces on loose, my shoe could actually come off. See, ligaments is what holds, and a great example is always the knee. That's why you see somebody testing the knee. They'll go up there and they'll pull on the knee this way, they'll push on it this way, they'll go to the side to see if there's any excessive movement. If there's excessive movement, that potentially means you've overstretched or torn a ligament. So soft tissue is your muscles, your tendons, and your ligaments. They aid in stability of the joints as well as mobility of the joints.
And again, with a lot of these, they'll creep up a little bit later in time. That's why it's important. You have a window really to get checked out, and it's a certain amount of days.
Right. Well, in the state of Florida, they've implemented a law that it's the 14-day rule. So once you've been involved in a car accident, you have 14 days to see a physician, have documentation of those injuries, or you lose your insurance benefits. And you could be paying for these insurance benefits 20, 30 years. You never had an accident. You have an accident. And what happens, Mark, to a lot of people, and we're all, I'm guilty of this too. I have something happen to me. I'm like, it's going to go away. It's going to get better. Let me just see what happens if it works its way out. So a lot of people will have a car accident. They feel their neck, they're turning it. It may not turn exactly right, but it's not limiting or affecting their ability to perform what they need to do. They're still able to go to work, or they're taking some Tylenol, some Advil. Then all of a sudden, they wake up, let's say 16 days, 17 days later, and they've got this excruciating pain going down their arm. Because what's going on is they sustained soft tissue damage to their neck. It wasn't biomechanically working right. It took those 16 days, like we're talking about with the car. Now you're going to turn your head and you're pinching these nerves that come out the side, in between the vertebrae. And when you have a pinched nerve, serious pain.
Absolutely. So obviously, get checked out. You have a small window in order to do so. Doc Tony, if people want to learn more and contact you, how do they do that?
Listen, I have 3 convenient locations throughout Jacksonville on the north side, west side, and south side of town. And my numbers is easy as it gets. It's 1-800-DOC-TONY. Do not procrastinate. If you had an accident, it's always best to go on the safe side. So always get checked out and call the doctor you can trust. That's me, Doc Tony.
Our next topic is, why is it important to find a doctor you can trust? Doc Tony, you've been in the industry for years, so obviously you're very passionate about it, and this is good guidance that everybody could take note of.
Right.
So why? Why is that important?
Number one, you want to make sure you're going to a facility that they know how to actually treat people that have sustained soft tissue injuries. And not every doctor knows how to do that. You got to, number one, know what you're doing, and then you have to have the equipment to treat people. And an example is you have to have therapeutic exercises, therapeutic equipment, therapeutic modalities, and you don't have to do that because our job is to reduce the soft tissue, reduce the scar tissue, enable the soft tissue to get back to its normal range of motion, pliability, so that the person's not left with long-term pain as a result of damage in their soft tissue. And you can't always do that. Like I said before, when you damage soft tissue, sometimes it's permanently damaged where it's not going to be healed to the original tissue the way it once was. And the best example I can give is if somebody actually sustained a cut on their forearm or their leg, and you've taken care of that cut on a daily basis, it still leaves a scar and it bleeds. And that's what happens with soft tissue injuries inside your body. It's no different in cutting yourself and cutting your skin. The body has to first stop the bleeding, then it starts to work towards healing the cut or the injury where there's a gap in the tissue, and it starts laying down new material, new tissue, just like when you have a scar on the outside of your body. You don't want scar tissue in your soft tissue because scar tissue is not as pliable, not as flexible, and it doesn't have the proper range of motion. It doesn't work as good as the original tissue. So that's number one. And secondly, you want to make sure you're going to somebody whose objective is to treat you properly and not take advantage of you. There are a lot of greedy doctors as well as greedy attorneys that are treating people that are injured in car accidents because there's money to be made there. So anytime there's money, there's greed can show up.
And what about surgery? Because sometimes it's a bad accident and somebody will find themselves going down that path of surgery.
Right.
But they're not all needed.
No, surgeries, especially in car accidents, are not all needed. There's a lot of surgeries that are done needlessly, where the people did not need it at all. And once you go to that extreme where you're ready to get back surgery, I would always recommend to somebody to always get a second opinion. And it's not always just the back surgery that creates the problem. What goes along, you think, with having that back surgery? They're going to prescribe these addictive medications that has created an unbelievable problem, not just here in Jacksonville, but throughout our entire country.
Yeah, when you talk about pain medicine that's being prescribed, really that's masking what's happening right now, and that's something that obviously you're not for.
Well, here's the thing. There's a time and a place for everything. I'm not opposed to surgeries. I'm not opposed to anything that can help somebody. But I am opposed when it's done only to make money, especially when you're doing surgeries or injections and prescribing pills. This is horrible. Anytime you give that out to somebody, they're going to go through withdrawals. That's the best scenario, Mark. The worst scenario is that they're going to become addicted. And when they become addicted, this doesn't just affect their life. It affects their families' lives, the kids, the community, the country. We have a huge problem. We are losing more people to drug overdoses than car accidents now. In Jacksonville, we lose 10 people a day to drugs. And a lot of these people are getting started on these drugs from the medical doctor, the pain medication. The doctors are prescribing to them, the greedy ones. And there's a time and a place for everything, but these are being, obviously they don't need me to tell them this, otherwise cities wouldn't be suing pharmaceutical companies. Obviously there was a problem. They gave these medications out far too liberally, and anytime somebody's gonna have a back surgery or injections, there's a good potential chance that they're going to also be prescribed these pain medications.
Yeah,
as
and for
well.
the patients out there, obviously it's very stressful and this is hard to navigate. So when it comes to picking a doctor they can trust, obviously it's super important because it's your health, it's your well-being. And then you're talking about collateral damage if you have pain medicine.
Right.
It affects the entire family and even the community.
Absolutely. My whole approach to everything is this. I don't like pain medication unless like I said, they're for extreme pain. And you can have that in car accidents, don't get me wrong, but this pain is tolerable, it's manageable. And there's therapeutic modalities, there's all type of natural things that you can do to help reduce the pain. I don't like pain medication because if your oil light came on in your car and you pulled into a gas station, and the guy said, oh yeah, Mark, step around the corner, and he just took the fuse out, and the light's not on no more,
right.
Well, you think, hey, everything's good.
And we talked about this on other shows. Pain, well, that's your body communicating to you.
Right,
as
right.
soon as you cut that off, like your analogy with the car, you don't know what's happening, so how do you know if you're getting better? It's just masking it.
Not a good thing, because like you're gonna use, now if I'm in pain, I'm on a pain medication, I wanna turn my head left, my body tells me don't do that. If it's a shoulder problem and I had pain, it's gonna tell me don't raise it. But if I have that pain medication, I'm gonna use it. If I get the injection into it, I'm gonna use it. When that wears off, the pain is worse. The problem's worse because you didn't rehab it, you didn't treat it, you masked the pain that enabled you to use it. Doesn't make sense.
Yeah, so no matter what, get that second opinion. It's very important.
Always second
And then
opinion.
you want to find a physician that you can trust.
Always, that's why I'm always saying, call the doctor you can trust. That's me, Doc Tony. I would never take advantage of people. You know, I love people. I got into this profession because I love to help people. I'm involved in treating people that are involved in car accidents as well as people that just hurt themselves doing everyday activities. But there is so much greed and unnecessary things that are done when people are injured in car accidents. And I would just, I really want people to hear this message and make sure that you, your friends, or anybody that's ever been involved in a car accident, that they always get a second opinion. And anytime, if you had a car accident and your doctor wants to prescribe you pain medication, you don't have to take those medications. You don't need to do it. Especially if you feel you don't need it, don't take them, because once you start on these medications, it's very difficult to get off them, and we don't need more people becoming addicted.
Yeah, that's a great message. If people want to learn more about you, how can they contact you?
Listen, if you need a second opinion, or if you just need to talk to me, or if you've been involved in a car accident, you can reach me at 1-800-DOC-TONY. Thank you, Jacksonville.
Our next topic is still on pain medication, but really what's happening right here in Jacksonville. And this is something near and dear to your heart. A lot of stats out there, and they're very sad.
Yeah, no, it's horrible. It's horrible to hear. Anytime I hear about anyone that's passed away, I've lost a lot of my friends. So it's something that really upsets me because it's needless. There was no purpose. There was no reason for this. It's all about money, and it's all about greed. So this is the biggest problem when people get tangled up in personal injury cases. You know, it makes it easier to present a case where the person's more messed up, unfortunately, and only with greedy ones, not good attorneys or not good doctors, and they prescribe these pain medications to them. And you know, once you get prescribed these pain medications, Mark, the best scenario is you're going to go through withdrawals. The worst scenario is you're going to become addicted. And we've got a lot of people from the ages of just young kids all the way up to, you know, our elderly senior citizens that are addicted to these pain medications. And a lot of them got addicted as a result of a car accident where they should have never been prescribed these medications in the first place.
Yeah, so the actual path that started it was something totally innocent and natural, And then after a while, as soon as that prescription went away, there's still that need because they're addicted to it.
Right, a lot of times that happens. Let's say the person started out getting pain medication, and for whatever reason, let's say they didn't end up getting the surgery, and their treatment is over. And the doctor's like, you don't need the pain medication anymore, and he wants to cut them off. Well, the person's still addicted. So now they're not able to get these pills, so now what happens? So now they're getting it from heroin. And the problem with heroin in the street, it's laced with fentanyl. This is the main reason that the death rate or the overdose rate has skyrocketed because of the heroin and because of the fentanyl. People had a problem still with the pills before, but it's really just raised, the bar has really gone a lot higher. We lose, Mark, more people from overdoses than car accidents now. This is the big problem, and it affects our entire society. Do you know that Jacksonville is second in the state of babies being born addicted? We had a problem in the 80s where the babies were born addicted to crack. Now the problem, we have babies born addicted to opioids.
Yeah, that is sad. And I'm glad you're raising awareness with this. It's important to have this conversation with everybody, and I think the viewers at home are definitely taking note. If people want to learn more about you, how can they contact you?
You can reach me at 1-800-DOC-TONY Jacksonville, and thank you. I appreciate you.
Our next topic, what to do immediately after a car accident. This is something that is so important, and during that time, people are stressed out and they might not be making the best decisions.
Right. Well, number one, always call the police and make sure you get a police report. That's your proof that you're actually involved in a car accident. Even if it's a mild car accident, don't ever think like, everything's okay, because a lot of cars are meant to absorb that force. They've got those bumpers that can absorb the impact, and the damage is not always visible on the outside, it's on the inside, like the person. And if you don't have a police report, then there's no proof that you actually had a car accident.
So that's a great note. No matter what,
always
get the authorities involved.
Yeah, whether it's you or whether it's your car, you come to find out, oh, wow, look, the guy hit me, I came out, I looked at the bumper, everything seemed okay, and then, a week later, your tranny goes bad, your transmission, because like we said before, that force that hits that car goes through that car. All it's got to do is shake some things loose or break some things, and then you're going to have a mechanical problem and potentially a health problem as well. So always get a police report for sure.
And I would imagine in today's date and time, everybody has with them a cell phone. Start taking pictures and recording and take notes of what happened.
Yeah, it never hurts to take pictures of the scene, because you never know. This could turn into a legal matter, so you don't know at that particular time because you don't know if you're injured. But you should always take pictures. It's important to make sure that you always exchange all the proper information. And depending on the state of your injury or how you feel, a lot of times people think, okay, my neck's a little sore, let me go to the emergency room. And that's not always the best thing to do, to go to the emergency room, because emergency rooms are for emergency care, life-threatening care. They're not for soft tissue injuries. Those are things that are going to require physical therapy, long-term, some type of treatment that's going to take a couple of months or potentially longer. And they don't do physical therapy in an ER. And you could get out of there with such a huge, expensive bill that you're left with limited to no coverage left for treatment that you're going to require.
And that's what you specialize in as far as the soft tissue. So obviously to give you a call would make a lot of sense because you've seen a lot of these cases.
They should, listen, if you've had a car accident and your body was stumped, the sooner you get with a doctor and start treatment, the better. Just like if you cut yourself. You don't wait a week to start taking care of it. The sooner you take care of the cut and the better you take care of the cut, the less or the minimal the scar that's left behind. And it's the same thing when you sustain damage on the inside of your body. The sooner you start with treatment, the best thing to do is call me right after you're done dialing 911. Give me a call, we'll get you set up for an appointment and get you right into the office, because it's always important to have x-rays to make sure, because soft tissue can be overstretched, it can be torn, or it can be ruptured. And a lot of times when it ruptures, it pulls a piece of the bone out, especially in the spine, and this could be a potentially dangerous situation.
And earlier in the show, you made everybody aware that you have 14 days, so obviously you have to get to it pretty fast. Doc Tony, if people want to learn more about you, how do they do that?
Listen, like Mark said, you have 14 days, don't procrastinate. I have offices on the north, south, and west side of town, and you can reach me at 1-800-DOC-TONY. Thank you, Jacksonville.
Throughout this program, Doc Tony has been providing us with some great tips, but now it's time to learn more about you and how your clinic can help us. So my first question to you is, how did you get started?
Well, I've always been into physical activity, always been into sports, wrestling, boxing, riding motorcycles, doing different things like that. So I was always hurt. So I wanted to go to physical therapy school, PT school. So I was in physical therapy school and I hurt my back. I actually became a PTA assistant and I was going to go on to RPT school. So you have to do clinicals. So I hurt my back doing a bed transfers and picking up people and moving them to the bed. And I was always a big guy, so I didn't always lift with proper mechanics, I would just pick them up and put them in the bed. And when I hurt my back, and I was like, wow, I had this awful pain. And then I started getting an awful pain down my leg, and I'm young. I'm only like, at the time, like 20, 19, 20 years old, 21, somewhere in there. And the back pain is so brutal. And I wouldn't go to a chiropractor because unfortunately, medical profession at that particular time, even physical therapists put down chiropractic. And it's not a very good thing to do because it's just not factual. And so I exhausted everything that an orthopedic could do to me. I wasn't going to get back surgery because I saw what happened to people that had back surgery, and I was too young. I'm not going to do that. So I said, let me go try a chiropractor. So I went to a chiropractor. He gave me an adjustment. As soon as he adjusted my lower back, the moment I felt that thing pop, adjust, I was like, wow. I knew whatever he did just fixed the problem. I didn't have the symptom anymore because my alignment in my spine was out. So the moment he did that, that was it. For me, I knew that this was very powerful because I knew how lower back pain and sciatic pain affected my life. I mean, it was brutal. It's a horrible pain. Anybody that's experiencing it is a horrible pain. And so that's what motivated me to really want to become a chiropractor.
It's interesting, you being a patient and kind of walking through this firsthand is what really created the awareness, and that's what you do now. You help people along this whole process to recovery.
Right, and I love it because I understand. I love to see their face when I adjust them, and they're like, oh, that's it. I'm like, I know.
I've been there, my friend.
I know, isn't that great?
Now, what about your clinics? You have several. What can people expect from your clinics?
You call, make an appointment. You're going to come into the clinic. You're going to fill out some information, collect like any doctor's office. We need to collect your insurance information, your information. You're going to fill out some forms explaining what your injuries are and what's going on or what happened to you while you're in the office. Then you're going to receive an examination. You're going to be examined by a doctor. You're going to receive x-rays if they're needed, and most of the time they are, and any other diagnostic tests that you may require. And then you're going to, depending on what your injuries are, if it is soft tissue related, like car accident related, we're going to put you on a rehabilitation program to help minimize that scar tissue, and that's what's going to happen when you come to my office. You're going to get real treatment, conservative treatment in the sense of our objective is we try to stay away from injections and pain medications. We use those types of doctors only when it's absolutely necessary, and in my practices, it's very rarely necessary.
And obviously, just by talking with you, you are so passionate about what you do. What is something that you just at the end of the day gives you a smile, you just feel so rewarded with?
Listen, I feel happy, and every single time a new patient comes into our office, I really feel happy. And I'm so happy about that because my attitude is anybody that came into my office, I know they were saved. I know that person's not going to get taken advantage of, and that makes me feel good because I'm in this business. I know these people, and the people that are in this business that do the bad things that are watching this, they know that I know. You understand what I'm saying?
Yeah.
So when somebody comes into my office, I'm thrilled in the sense of I know this person's going to get good treatment. They're going to feel a lot better at the end of the day. And whatever compensation they're entitled to, listen, these are the laws. Like we talked about earlier, if somebody gets hurt, we provide compensation. Let's say this guy's a hard worker, he's a laborer, and he's one of these construction guys that can carry like 6 boards on this side, a bucket on this side, and he's injured. He may not be able to go back to that job.
Sure.
So the laws, we live in a great country that provide compensation for the injury, and there's no reason to take advantage of the person or the system.
And if people want to learn more about you, how can they contact you?
You want to learn more about me, you can reach me at 1-800-DOC-TONY. Again, thank you, Jacksonville.
And our final topic is making sure you have proper insurance. I'll tell you, Dr. Tony, this is something that's very complicated. A lot of people don't even know what they have.
Right. I wouldn't know if I wasn't in the business, to be honest. I wouldn't know. I know about this because this is what I do. But knowing your insurance before you have an accident is the most important thing because that's the only time you have to protect yourself. So let's say you're the minimal amount of insurance in the state of Florida, all you have to have is $10,000 in PIP. This is if you hit somebody in a car accident, you have $10,000 in medical coverage and property damage of $10,000. But if somebody were to, that's the minimal coverage. But let's say I hit you and I only have the minimal coverage. I have no bodily injury coverage for you should I have hurt you. If you don't have, let's say, collision, your car doesn't get fixed. If you don't have uninsured motorists, you have no other coverage for yourself except that $10,000 in PIP. So what I would encourage people to do is know their insurance coverage before they have a car accident. And if you don't have uninsured motorists or bodily injury, make sure you have it. You can't have UM unless you have BI. And BI means that you care about your neighbors, you care about your fellow citizens living in your community. Why would you not protect them? But the insurance companies don't mandate it because they make out big time by people not having proper coverage.
And when it states full coverage, that doesn't necessarily mean
that means
full coverage.
No, full coverage doesn't mean full coverage at all. In fact, a lot of most people have no uninsured motorists. they'll actually sign a little waiver that they didn't want that. You want to make sure you have BI, bodily injury coverage. Again, this will protect, if I was the person that hit you, I'm the at-fault driver, I have coverage to protect you. And you want to make sure that you have uninsured motors. That will protect you against underinsured or uninsured drivers. And as far as the BI that you want to, coverage that you might want to have, well, if you own properties, you own houses, and you own assets, you better make sure you have the proper amount of BI coverage, because an attorney, that's fair game. They can go after your assets should you cause severe enough damage to somebody else when you're involved in a car accident. So the mandatory coverage, all they're ordering you to have is property damage of $10,000 and personal injury protection of $10,000. That's nothing. That's an underinsured driver.
Yeah.
Okay, that's not good coverage.
And a lot of times people will go online, you could kind of put a little check mark of what you want, not even understanding what that means on the back end. So that's why it's important. There are certain things that you want to make sure that you're protected.
Absolutely. And your only opportunity, again, is before you've had the accident. I would suggest to all people to check out their insurance policy, to get their binder, call their adjuster if you see this show, and make sure, if you have insurance, then you know you have the least, the minimal, which is the $10,000 in personal injury protection and the $10,000 in property damage. But let's say you can't afford to replace your car. You better have collision. Otherwise, you wreck your car, and the person that hit you has no insurance, and you don't have no collision, you're not getting your car fixed.
And you mentioned Florida law is a little unique.
We're probably the third state with we're like the worst. We have the worst insurance. I don't know how to properly say that, but we're like that. We don't have good coverage in the state of Florida.
And that's why it's even more important to do your due diligence.
You've got to do your due diligence, because the lobbyists and the insurance, they're winning, and the insurance companies are winning. By not mandating that people have bodily injury coverage, this is a big problem. Because lots of people, your life can change in a second. You get hit and you don't have no coverage and you're hurt and you can't return to that job, this is a problem. And if you've been a good driver and you've been paying your insurance for years, having uninsured motorists as part of your policy is not that expensive, and bodily injury is not that expensive. In fact, your insurance actually goes down because it shows that you've had coverage, that you're protecting other people. And if you've had this for a period of time, your insurance actually goes down in cost.
Yeah, Doc Tony, we kind of came full circle with everything here, and there was so much information on what to do if you or someone you love is ever in an auto accident. So it started out really with the culprit of force and soft tissue, and how important that is to really understand. You have 14 days to make sure you get in. A lot of people forget about that. And then there's so much that you just have to do as far as the steps you're taking with documentation, get the authorities involved. The other thing that I learned today too is when it comes to actually picking a physician, you have a choice here. So even though you might be going down the route of surgery or pain medication, you could actually stop and get a second opinion.
Absolutely. Listen, a lot of times the attorney, only the greedy ones, not the good ones, and I want to reiterate that. Only greedy attorneys, they control the medical. They actually tell the doctor what to do. They're in control of it all. And a lot of the greedy attorneys, they own the surgical centers through creative accounting, and they own the pain management centers. They own it all. So they're motivated to send you and have these unnecessary procedures done to you. So without a doubt, you've got to be very cautious when you've been involved in a car accident, who you hire as your attorney, if you seek an attorney, and what physicians you are going to. What I always say is the safest thing to do is call the doctor you can trust, and that's me, Doc Tony.
And then how do they do that?
You can reach me. Like I said, hey, I got 3 convenient locations, Mark, in Jacksonville, on the north side of town, on the south side of town, and on the west side of town. And you can reach me at the easiest number there is. That's 1-800-DOC-TONY.
All right, well, thank you so much for all your time.
Thank you, Mark.
And information. Thank you, Blue. I think we lost him
Blue's
about 10 minutes in, but that's fine. We'll give him a copy of this.
Absolutely.
Well, thank you.
He's due for lunch at Ted's now.
I think we all are. Thanks again.